Joining us now is U.S. Surgeon General Dr. Jerome Adams. Dr. Adams, good to see you again. Let's start right there. I think we've just laid out the debate. So my question to you is a real simple one. Do you expect the CDC to change its guidance and suggest that Americans should wear some kind of face covering when they go out in public?
Well, thank you for that question. It's important to know the CDC, the World Health Organization, and my office originally recommended against the general public wearing face masks based on the best available evidence at the time regarding whether or not they could prevent people from catching the coronavirus. We are learning more and more about this virus. As Kate mentioned, we now know that there's a significant amount of asymptomatic spread, and the task force has asked the CDC to look into whether or not we should change our recommendations to prevent people from spreading the novel coronavirus. But here are the important points. If you're going to wear a face covering, please try not to touch your face. Please be very, very careful about making sure you don't touch your face. Number two, if you're going to wear a face covering, please save the N95 mask for healthcare workers who need them. And then number three, wearing a face covering does not mean that you don't have to practice social distancing. The most important thing you can do is stay at home right now, and we don't want people to feel like, okay, I'm covering my face, so now it's okay for me to go out in public.
And on that topic, yesterday the White House had a very sobering briefing, put a chart up that said if we do social distancing correctly, everyone does it correctly, we're looking at 100,000 to 240,000 deaths in this country. Are you concerned that as we sit here this morning, 17 states still don't have stay-at-home orders?
Well, yesterday was somber news, but there was also good news buried in there. The somber news is that coronavirus is spread all across our country, all 50 states. No one has been spared. The good news is that states like Washington, like California, countries like Italy, when they leaned into aggressive mitigation, they're being able to flatten their curve, and we know that if you do this, that it usually takes about 3 to 4 weeks from the time you start to lean into it before you level it off.
Well, that's exactly right. I mean, I guess that really underscores the question I'm trying to ask here, which is you're saying the states that did it and have these stay-at-home orders are already seeing the benefit of it. We've got 17 states that haven't. Shouldn't every state in this country have a stay-at-home order? Is this question?
Well, that's the whole point of these 30 days to slow the spread guidelines that we put out. We want nationally people to understand the importance of social distancing. We live in a nation that has a system of federalism, and the governors get to make the decisions, but we're going to give them the best possible guidance we can, and that's to stay at home and to social distance.
Okay, and sorry for the interruption, but unfortunately, these are urgent times. Let me play you something from Florida's governor. He said he has not received a recommendation for a statewide stay-at-home order from the federal government, and he's waiting for that. Let's listen.
The task force has not recommended that to me. If they do, obviously that would be something that would carry a lot of weight with me.
So he's saying he's waiting for somebody at the White House to tell him to shut it down in Florida. What would your advice to him be?
Well, my advice to America would be that these guidelines are a national stay-at-home order. They're guidelines that say that, look, the more we social distance, the more we stay at home, the less spread of disease there will be.
Is there any good reason for a governor not to have a stay-at-home order right now?
Well, governors have tough choices to make. They have to decide whether or not they feel like their citizens will listen to them without a stay-at-home order. But again, the most important thing is to stay at home. Stay 6 feet away from each other. That's how you slow the spread.
We saw the timeline yesterday, and it's you've talked about the 30 days. And I remember you were on with us when we first had the initial 15 days, and you were very straightforward. You said it could be longer than 15 days. Sure enough, here we are. We now have another 30 days of social distancing required. But when you're talking about what's needed and what's ahead, isn't it very likely that the social distancing will have to be longer than even this 30 days? In other words, past April 30th, in order to contain the spread and get that optimistic scenario of 100,000 to 200,000 deaths?
Well, that's a great question, and what we've always said is that everyone is on a different place on their curve. Some places aren't going to hit their peak until after 30 days, and they're going to need to continue social distancing. Other places that leaned in early may be able to relax some of their recommendations earlier. And when we say relax, we're not going to go back to saying, hey, well, I've never said as Surgeon General you shouldn't wash your hands or you shouldn't cover your cough, but we're going to start to look at how we can ease people back in. And that's one of the things we're looking at with the mask recommendations. Is there a possibility that we can use cloth masks to allow people to start to come back together once they've gotten over their peak and flattened their curve? These are questions we have.
Yeah, I hear you on everybody's going to have a different situation, different states, different hot spots. I guess to put a fine point on it, is it in the realm of possibility at all that the White House and the task force could say in 30 days, that's it, we don't have these guidelines anymore, you don't have to social distance anymore, it's over?
In my opinion, I think that in 30 days, we will still be telling the country in general that you need to practice these measures, but in 30 days, some places may not need to have a shelter in place anymore. So again, we'll start to ease this in 30 days, I think, but in some places, but in other places, we'll be ramping it up. We'll follow the data, and we'll go on based on what the data tells us.
Okay, let's talk about ventilators. We know that there aren't enough ventilators, unfortunately. Let me tell you what Governor Cuomo of New York said is the scenario right now as states like his try to get ventilators. Let's roll that.
So you have 50 states competing to buy the same item. We all wind up bidding up each other and competing against each other. It's like being on eBay with 50 other states bidding on a ventilator.
Now, the fact that there aren't enough ventilators is perhaps nobody's fault, but isn't there a better way for states to go about getting these ventilators?
Well, that's a great question. I talked to the head of the stockpile just this morning, and we're trying to work with governors to come up with a better way. We're trying to purchase what we can for the stockpile and send it to places like New York that need it the most. But we're also trying to make sure other states and governors can get priority purchasing at a reasonable rate. So I think the governor of New York makes a fair, raises a fair concern, and that's one of the things that we're working with to try to make sure the equipment can get to where it's needed in an efficient way and without price gouging.
And this finally, Dr. Adams, I mean, you're a physician. This is your life's work. I just have to sit with these numbers for a moment. In the best case scenario, the White House is saying we may have 100,000 deaths. Right now, there have been just under 4,000 deaths in this country. Are we looking at 96,000 people dying in the next few weeks?
Here's what I want you and America to know. Those projections are definitely sobering, but they don't have to be our reality. If we really do our part, stay at home, social distance, then we can flatten our curve even below those projections. But it really depends on all of us. And I commit to you all as Americans that as Surgeon General, I'm going to do my best to get you the information you need. We're going to do our best as the task force to make sure the federal support is there. But we need state and we need local people to come together with federal support to make this possible. Those numbers don't have to be a reality.
We're all in it together. Again, Dr. Adams, thank you for your work on behalf of our country. Thank you for your time this morning.